I would say the risk to kidney function from dietary protein intake is based more on a presumption than data. Mm-hmm. Just when protein is eaten in moderation, there is very little evidence in when people have normal or even modestly impaired kidney function that will negatively affect kidney function. Okay. In our 1-year data from the IUH study that we published a couple months ago, the commonly used measure of kidney function is something called serum creatinine. Yep. And that's a product that's produced metabolically in the body and has to be cleared by the kidneys as a waste. And the level of creatinine over the course of a year in people with pre-existing type 2 diabetes, so their kidneys are already being challenged by their diabetes, the creatinine level went down slightly but statistically significantly in the context of a well-formulated ketogenic diet. So we saw no evidence at 1 year of any negative effects of moderate protein in the context of carbohydrate restriction and circulating ketones. Mm-hmm. And we will have hopefully data from 2 years that we'll publish from 2 years as well. So again, this is not a high protein diet. That's really, we have to emphasize that. Protein is eaten as when we say moderation, it's in a range that if you're talking about macros in terms of what the body is burning in a day, we're providing 10 to 15%. At most 20% of daily energy intake is protein. Some people advocate higher protein intakes with carbohydrate restriction, let's say with the paleo diet, and that does not appear to be necessary. We don't know whether that's safe or not, but certainly at the levels that we counsel people to do this, we have every evidence of improving kidney function, no evidence that there's a negative impact on renal health.